Welcome and peace be with you. In this session on the philosophical principles of Tibb, we're going to focus on treatment within the whole paradigm of the Tibb system and Tibb philosophy. Now, as the philosophical principles of Tibb makes it possible to identify the cause or causes of most illness conditions, treatment is therefore targeted. The targeted approach is aimed at restoring balance or homeostasis between the humors and the qualities in relation to the temperament of an individual, and always working with vices. In addition, treatment always includes lifestyle factors, thus ensuring that not only are the symptoms treated, but that the underlying cause or causes of illnesses are also addressed. Unfortunately, in Western medicine, because of the limited understanding of the causes of illness, treatment is invariably aimed at addressing symptoms. Let's talk about the treatment options in Tibb. Tibb is fortunate to have many tried and tested treatment options that have been developed over centuries. And these include, in a broad category, firstly, application of the Tibb lifestyle factors, which is always considered the first line of treatment, and considered the most important in both treatment and management, especially in chronic illness conditions, where ultimately addressing the lifestyle factors will make a big difference in the management and treatment of chronic conditions. Secondly, the other broad category is eliminative therapies. These include, amongst others, healing modes such as cupping, diuresis, massage, purgation and enemas, nasal inhalation and heat therapy. All of them aimed at eliminating excess abnormal humors in keeping with the Hippocratic principle of pepsis, as discussed in the link on how illness is developed. Let's talk about Tibb pharmacotherapy. The appropriate use of mostly herbal formulations together with minerals and a few animal-derived products, which have been time-tested for over many centuries. Now, herbal formulations from whole plants or plant extracts are used in Tibb, which makes it safer compared to higher doses of isolated active ingredients from plants, such as curcumin from turmeric. Obviously, active ingredients from plants have far less side effects compared to chemical-based medications used in Western medicine. Also, I would like to highlight that there is a unique approach of treatment in Tibb. This unique approach of treatment in Tibb is in keeping with the original understanding of allopathic medicine, where the word allo is a Greek term for opposite. Treatment is based on the concept of opposites, both with respect to lifestyle factors as well as pharmacotherapy. For instance, medication formulated to treat cold and flu will not only include the pharmacological action that will counter or rather be opposite to the symptoms of a cold and flu, but also has qualities that are opposite to the signs and symptoms of the flu. For example, the pharmacological action of ginger is often included in common cold formulation, as it counteracts the specific symptoms of runny nose, fever, chills. However, it has also heating qualities which oppose the cold and moist symptoms associated with the flu. Similarly, lifestyle factors is aimed at increasing the heat and dryness to overcome the cold and moistness associated with the cold and flu. And we all know that one of the old recipes recognized is a bowl of hot chicken soup. In conclusion, on this discussion of treatment in Tibb, based on its principles of Tibb, has a targeted approach with therapeutic options aimed at restoring balance, homeostasis between the humors and qualities in relation to the temperament of the individual, and always working with vices. This approach not only addresses the signs and symptoms of illness conditions, but also addresses the underlying causes of disease. Thank you.